It's time to end the physical therapy debate. And what is that debate? Well, on social media, there are largely two groups of physical therapists. And I'm primarily referring to outpatient orthopedic sports physical therapists. There is one group, which is more of the traditionalist physical therapist, that is doing exercises in an open chain environment, oftentimes on a table. There are many different exercises. These could be things like a pelvic tilt. It could be any number of straight leg raises, side-lying hip external rotation with a band, i.e. clamshells, prone press-ups, knee to chest, etc. There are hundreds of these types of exercises. And then there's another group that is going to be more of the high dose physical therapists that are thinking about exercises where the patient is on their feet, closed kinetic chain, large compound movements, using Olympic weights, using kettlebells, etc. And what I have largely seen on social media is that this high dose group tends to discount or diminish those lower level open chain table exercises. I am here to tell you that both groups are right and both groups may be wrong. There is a very simple thing that physical therapists have to come to grips with, and that when it comes to exercise, it is the right exercise at the right dose, at the right time in the rehabilitation process, in the right patient. There is no perfect exercise. If a physical therapist is saying that this is the exercise, or if a physical therapist is saying, if you are doing this exercise, you are not helping your patient. Let me tell you, after 37 years and running the spectrum between seeing patients in a hospital with orthopedic problems all the way to high-level sports rehab, we need the ability to run the gambit of exercise, and we need to identify the right exercise at the right dose, at the right time, in the right patient. There is a time and a place. I don't believe that there are very many bad exercises that you should never do. And I certainly don't believe that there is any one magical exercise that can somehow fix everything. We have to assess our patient, identify where they are at, and that might include where are they at in the tissue healing process, where are they at in terms of what they're capable of doing, where do they want to go, what are their goals, and then we need to tailor that exercise routine to that individual, and then we need to progress it. And sometimes we have to regress those exercises. If you are doing those low-level table open chain exercises, and it is 6 weeks, 8 weeks down the road, then you're probably missing the boat. If you are taking an acute patient and you have them up doing plyometrics and large compound movements with an Olympic bar and with kettlebells, then you are missing the boat. Let's end this debate. Let's find the right exercise at the right dose, at the right time, in the right patient. And let's consider the possibility that we can use the spectrum of exercise.